Hey everyone, Tony here. So I wanted to use this video today to talk about picking your best therapist. Too often I read stories about patients going to physical therapy for various conditions. You guys are all here for knee replacements. But what has been kind of a thorn in my side for almost 2 decades of patient care is the fact that you, the patient, either don't realize, don't know, or don't think you have the opportunity to really take an active role in choosing who your physical therapist is going to be. I want to talk about a couple factors in this video, but then if you guys want to hear more about this, I can share more videos on the topic. But basically, I always go back to my mom. I think of my mom, my dad, family members. They're fortunate enough to have a physical therapist in the family, even if I can't treat them because they live out of the area. So, of course, when they call me and they say, "Hey, Tony, I need to go see a physical therapist. Who should I see?" I've got advice ready for them. And that's the advice I'm going to give you right now today. So the first thing I do is I say, any good therapist will absolutely be happy to talk to you on the phone for a couple minutes before you ever even schedule an evaluation. And I think that's important. If they're too busy to spend 3 to 5 minutes talking to you on the phone before you schedule, they're probably too busy to really treat you the way you're supposed to be treated. So I'd scratch that clinic, that therapist off the list. But if it was me talking to my mom, first thing I'd do, I'd pick up the phone, I'd pull up my list of possible clinicians, and I'd start making calls. And I would say, "Hi, my name's Tony. I'm having a total knee replacement on July 15th. And I was just wondering if I would be able to speak to the therapist who's going to do my evaluation before I schedule." And if they say yes, usually the therapist will have to call you back. That's fine. When the therapist calls you back, my first couple questions would be, could you give me an idea of what I could expect during the first week or two coming to your clinic for therapy services? And then that therapist should be able to tell you. So let's pretend you're calling my clinic right now and you're saying you're going to have a knee replacement 2 weeks down the road, and you'd love to know a little bit about my clinic and what we would be doing for you during the first week or two of therapy. So I would say, "Okay, Bob, thanks so much for calling. My name's Tony. I'm actually the therapist who's going to be working with you doing your evaluation. Now, we use a team approach here. There's two of us that work in the clinic. So you won't be just working with me. It'll be myself and Jeremy. Jeremy is my physical therapist assistant. We work together on all the patients. To give you an idea of our treatment philosophy, we tell everybody in the beginning, you should leave feeling like you could have done more. If you overdo it in those first few sessions, you're going to be so tired and so wiped out and so sore, you're not going to be able to do the rest of the stuff that you want to do outside of therapy. So our goal here in therapy isn't to beat you up. Our goal is to make you feel better, to answer your questions, to bring you peace of mind, to help you understand what's going on, and then to show you what to do outside of therapy. So when you leave our clinic, those first couple sessions, you should almost feel like you wanted to do more. That's a perfect level, because if you do too much, it's just going to slow down your progress. And then, Bob, what we usually do is after the first week or two, once we have a solid foundation, once we understand what you can do, where your level is, then we can start to progress. Each time you come into the clinic, we're going to be doing new stuff, different stuff. I'm not going to do stuff you can do at home in the clinic, because that would just be a waste of your time. And so each session in the clinic will be some review, but mostly new stuff. And if at any point we push you a little too hard, or you feel like we did too much, or we flared something up, or you're more uncomfortable, you just let us know. Because the reality is, what you do with us for 60 minutes should improve the other 47 hours between sessions that you're outside of the clinic. And then, so these are things. And then if you want even more specifics, then I'm happy to explain, that when you come in for the first day, we're going to do an initial evaluation. We're going to take some measurements, but nothing that's going to be super painful. We're going to do a little walking and moving around to see how you're functioning. If you're up for it, and you're feeling like it, we'll do some exercise, but I'm going to show you the 3 most important things I want you to start doing at home this week. And then each time you come into the clinic, we'll add a little more. You can expect to be in my clinic for about 40-45 minutes the first day. We'll eventually build up to 1-hour sessions. But as I've said, what you do with me in the clinic is nowhere near as important as what you do the rest of the time outside the clinic. And my goal for you is to get you on your feet, to get you moving around. I tell my patients all the time, look, if you're drinking enough water, you have to go to the bathroom every 1 or 2 hours. That's going to get you out of your seat. That's going to be your best home exercise program. So these are the kinds of conversations that I want you to have with your therapist. Now, it's totally within your right as the patient to ask, are you going to aggressively push on my knee? I think that's totally reasonable. And if you were to ask me or anyone on my team, absolutely, we would say no. We would say we believe a patient would rather progress maybe a little more slowly, but at their own pace. The body is going to heal on the body's time schedule, not anyone else's. Everybody is unique. We're going to work in the range of discomfort, but not pain. And the only one who can tell us when we're at the range of discomfort and not pain is you, the patient. These are some of those questions. Now, of course, the last component that I think everybody should be asking about is, are you going to see the same therapist or the same team every single session? Or are you going to be switching between therapists? Is there a better time to come into the clinic? If you're flexible on time, assuming you're not working and you don't have other commitments, I would absolutely be asking the therapist, when is the slowest time in the clinic? Because that's going to be the optimal time for you to go to therapy, especially now, the way things are with social distancing. And then I would want to know about cost. And I think cost is an important factor that we often overlook. I know in my clinic, we are participating with all insurance plans. We're participating with Medicare and Medicare Advantage plans and all non-Medicare plans. Some clients come to me with a $50 per visit copay. They're expected to pay $50 no matter what they do every single visit. Other patients come to me with no out-of-pocket cost because the surgery covered their out-of-pocket max and there's no added cost to it. I'm going to produce a plan as a therapist. I'm going to produce a plan of care very specific to you, the individual. If you came to me and said, Tony, there's no way I can afford $150 a week to come 3 days a week. No problem. I'm going to modify things. So maybe you come once every 2 weeks. I give you stuff to do at home and we stay in communication through the phone. Whereas somebody else might say, Tony, I have nothing but time. I know I won't do it if I'm sitting at home. I would love to come in for, 5 days a week if you would let me. No problem. We can think about it from a perspective of some people might do better 5 days a week for 20-minute sessions. Other people might do better once a week, once every other week for 60-minute or 90-minute sessions. Everybody is unique. Everybody has a different standard. And as much as I love my profession and I love what we do, and I'm in this almost 20 years and I still I literally dream of new things to do with my clients on a regular basis because I just enjoy what I do so much. There's absolutely large, busy clinics that just can't afford you, the patient, the flexibility that some of the other smaller clinics can afford. So I'm never going to say anything bad about any clinicians that are out there, but what I'm going to say is you want to find the provider that matches your needs. I often say a 82-year-old geriatric who is retired and just loves gardening and loves working around the house, who had a knee replacement, might require a very different therapist compared to the 20-year-old who is involved in a car accident, who's a collegiate athlete who wants to get back to sport. They're both getting knee replacements, but they're both potentially looking for very different clinicians. So guys, use your freedom, exercise your right. You can choose who you work with as a physical therapist. I would explore every possible option in your community. And remember, You might not even know about the therapists that are available. We have a whole bunch of therapists that are doing what we call mobile physical therapy. That means that it's outpatient therapy, just like you would go into a clinic, but they don't have a clinic. They come to your house. It's still covered by insurance. And if it's not, they offer self-pay rates and you can ask them about pricing. But mobile physical therapy has grown in popularity. Telehealth physical therapy, this conversation you and I are having right now, it's totally available to you. Anybody in your license in your state can come on and provide you with a telehealth physical therapy session. These are crazy times and we have amazing opportunities in front of us. I just want you guys to know what's available. Listen, if you have specific questions, if you really want to know something, please post your comment on YouTube under the video, because the more comments you post for me, I try to answer all of them. I usually get to them within a couple of days or a week, but the more comments you share with me, the better videos I can produce for you. Guys, I hope this was helpful. I really do. Let me know what you're thinking. I'll catch you guys on the next video.